right, this is an article on Naturopathic Medicine, a 10-year perspective from a 35-year view. Written by Joseph Pizzorno, published in Alternative Therapies in Health and Medicine, 2005. 35 years ago, when I entered Naturopathic Medical School, the prospects were grim. The National College of Naturopathic Medicine, which was not accredited and had no path to accreditation, was the only school in existence. The entering class before me enrolled only 2 students. The most modern textbook had been written in the year of my birth. Only 6 states licensed naturopathic doctors. Any media story about natural medicine was pejorative, and every court decision further restricted practice rights. In fact, when I was a third-year student, the Washington State Superior Court ruled that prescribing anything, no matter how natural, to a patient to treat a disease made the therapy a drug. Since we practiced under the 1918 Drugless Therapeutics Act, we were rendered essentially unable to prescribe our medicine. While on a field trip into the Cascade Mountains, where our beloved teacher, John Bastier, chiropractor and ND, was teaching us the medicinal properties of nature's healing plants and showing us their habitats and natural forms, I asked him if there was a future to this medicine. I remember vividly, as if it were yesterday, as he looked at me in his kind and caring manner and said, "No matter the obstacles, the truth of our medicine will prevail." He proved prophetic, but it took decades. Several years later, in 1978, when we decided to create a new naturopathic medical school based on scientific principles, we decided to name it Bastyr University, after the wonderful physician and healer. Unfortunately, the dire condition of the profession had not improved. There was no core of qualified faculty trained in the biomedical sciences, no ready source of prepared students, no researchers trained in both natural medicine and objective scientific exploration, no money to help us start, and foundations that supported healthcare wanted nothing to do with anything unconventional. Remarkably, this all changed. By 1995, the environment for naturopathic medicine had improved dramatically by every measure. This occurred through both important improvements in the profession as well as increased public awareness and acceptance. In many ways, the profession of naturopathic medicine grew up. Its growth was aided by the development of an effective national association, the American Association of Naturopathic Physicians, which was founded by James Sensenig, ND. Not only did the AAMP provide a national voice and federal representation, it took on the surprisingly difficult task of definition. What is naturopathic medicine, really? Pamela Snyder and Jared Zeff took on this challenge, and through several years of meetings, discussions, and negotiations, created both short and long definitions of the profession. From these definitions, they generated practice principles that have endured and are now widely embraced. During this period, other critical national organizations evolved. In particular, the Council on Naturopathic Medical Education, which accredits schools, became recognized by the U.S. Department of Education in the Naturopathic Physicians Licensing Examination, the National Examination Board, as the standard for all states that license naturopathic doctors. To address the lack of modern textbooks, Michael Murray and I wrote and edited the now widely acclaimed Textbook of Natural Medicine, first published by Bastyr University Press. Of particular significance was its establishment of a scientific foundation for the philosophy and practice principles of the profession. Modern textbooks, qualified faculty, and higher educational standards led to naturopathic medical schools becoming accredited for the first time ever. With the growing sense of professional unity, more credible practice standards, and stronger educational programs came more licensing, updated practice statutes, more schools, and many, many more students. The total enrollment of 15 students in the one naturopathic medical school of the early 1970s grew to 1,000 students enrolled in 3 schools: the National College of Naturopathic Medicine, Bastyr University, and the Southwest College of Naturopathic Medicine. The number of states offering licensure to naturopathic doctors increased to 10, and almost all of these states had adopted more scopes of practice consistent with the modernized education. Of particular significance was the establishment of research departments at all the schools. The establishment of a research center of HIV/AIDS at Bastyr University in 1994 marked an extremely significant threshold with the federal government. For the first time, recognizing the validity of supporting research and researchers at naturopathic medical schools. In 2005, the public acceptance established a decade ago is now being recognized by the media, conventional medicine, and state and federal governmental legislators and agencies. Equally important, the naturopathic profession has matured significantly. The changes have been qualitative as well as quantitative. One of the early changes I noticed began in the mid-1990s with the media. Whereas in the past, our positive reports were ignored and our negative reports were portrayed in a sensational manner. The media now sought our research, and the reporters and stories were supportive and encouraging. By 1999, the media attention had become so heavy at one time, I was spending almost 25% of my presidential time at Bastyr responding to media inquiries. The schools began hiring professional public relations staff. The first major breakthrough in governmental acceptance was probably the King County Natural Medicine Clinic. This was initiated by Kent Pullen, since deceased, chair of the King County Council. King County is the 12th largest county in the country. His idea was to create an integrated care clinic for low-income or underserved populations, supported by governmental funding. Through his efforts, this landmark clinic was established and supported by county, state, and federal funds. Of special significance, it was co-directed by a doctor of medicine, Marty Ross, and a naturopathic doctor, Jane Giltnan. The clinic was immensely successful, and community health centers of King County, the site of the first clinic, has made natural medicine services available in the rest of the 7 clinics in its system. An interesting anecdote arose from an enterprising reporter who interviewed its members of the King County Council, who voted unanimously to authorize the clinic. He found that 9 of the 13 members were seeing natural medicine healthcare professionals, but had not told each other. Naturopathic doctors now practice in approximately 65 community and public health clinics across the country. The governmental acceptance of naturopathic medicine has manifested the past decade in many ways. Whereas 3 decades ago, the primary activity of government seemed to be to suppress the profession at the behest of the medical establishment, naturopathic doctors, with their deep understanding of health and wellness, are being fully embraced by governmental agencies. For example, for the first time ever, naturopathic doctors were appointed to a board of health. For instance, Pizzorno to Seattle King County, the governing board of a public hospital, Giltnan to Harborview Hospital, Medicare, Pizzorno and Snyder to the Medicare Coverage Advisory Committee, and the current Procedural Terminology Advisory Committee, Milliman. When a special commission, the White House Commission on Complementary and Alternative Medicine Policy, was created to advise the President and Congress on how to incorporate natural medicine into the healthcare system, a naturopathic doctor, Pizzorno, was included. Another important development is the eligibility of naturopathic doctors to take part in loan forgiveness programs when providing service to low-income or underserved populations. But perhaps the most exciting political development happened in Australia. Southern Cross University, a federally funded regional educational and research institution, established a 4-year education program in naturopathic government with the same high-quality facilities and tuition subsidies as other programs, the first in the world. The increased government acceptance has also been reflected in 13 of the United States. The District of Columbia, Virgin Islands, and San Juan have also begun licensing naturopathic doctors. When California began licensing, the number of Americans having access to licensed naturopathic doctors doubled. And of special significance for our patients, most of the states offering licensure to naturopathic doctors have instituted insurance equality, mandating that our services be paid at the same as conventional practitioners. With the increased licensure and funding has also come some expansion of scope of practice. As more naturopathic doctors practice in rural and underserved areas, meeting the needs of these patients has required skills in and access to more conventional interventions, such as acute care drugs and minor surgical procedures. Collaborations have now been established between naturopathic and conventional medical schools and organizations. This is most evident in research where partnerships between, for example, Bastyr University and the University of Washington School of Medicine and the National College of Naturopathic Medicine and Oregon Health Sciences University have engaged in several studies. We are also now seeing cross-training in research where naturopathic doctors are doing postdoctoral training at conventional medical schools and research institutions, and doctors of medicine and philosophy are learning natural medicine theories and engaging in research under National Institutes of Health grants at naturopathic institutions. The increased commitment to research is an important indication of professional maturation. This has resulted in the establishment of the Naturopathic Medicine Research Alliance, funded by the NIH to set an agenda to prioritize the investigations needed to assess the validity of the foundation principles of the profession. The work of the past few years to determine meaningful methods for evaluating and documenting the efficacy of naturopathic practices, how to document and verify successes, is perhaps the most important research accomplishment. The political alliances that have grown from exclusively complementary and alternative medicine groups to those that include conventional practitioners and organizations are also of interest. Examples include the National Policy Dialogue, the Building Bridges Group, the Integrated Healthcare Policy Consortium, and the National Education Dialogue to advance integrated healthcare, creating common ground. The groundbreaking decision by Churchill Livingston, now Elsevier, a major publisher of conventional medicine textbooks, to publish the Textbook of Natural Medicine, and the success of the textbook, which includes more than 10,000 citations from the peer-reviewed scientific literature documenting the efficacy of the natural medicine therapies core to naturopathic practice, was another indication that naturopathic medicine has entered the mainstream. Not only was Churchill Livingston the first major textbook publisher to formally develop a natural medicine division, the Textbook of Natural Medicine became one of their best-selling textbooks of any type. In the past decade, many more textbooks have been written by naturopathic doctors, further codifying the body of knowledge and establishing science-based practice standards for the profession. In addition to textbooks, modern naturopathic doctors have now written many books for the public, providing not only the philosophical and self-care guidance, but an understanding of the science behind this practice. Books such as the Encyclopedia of Natural Medicine, with its 1,500 research citations, have sold over 1 million copies and have been translated into 6 languages. When Eat Right for Your Type by Peter D'Amo broke into the New York Times top 10 best nonfiction list, the profession experienced considerable pride of accomplishment. The increased research and improved understanding of the theoretical and scientific foundations of naturopathic clinical practice have been as important as governmental and mainstream acceptance. The past decade has seen a dramatic increase in research at naturopathic institutions and at other institutions, research of the therapies traditionally used by naturopathic doctors. Also of importance has been research further discovering human biochemistry and physiology, the understanding of which is critically important for effective naturopathic practice. The mapping of the human genome has been especially significant. The combination of improved understanding of human physiological, the elicitation of the physiological effects of botanical medicines and food constituents, we are now far beyond vitamins and minerals, and the greater recognition of the adverse physiological effects of environmental toxins have provided, for the first time, a sound scientific foundation for naturopathic principles and practices. The development of a new breed of diagnostic procedures, which have moved beyond detection of pathology to measurement of physiological function, has also been significant. Naturopathic practice, which in the past was primarily based only on philosophical principles and clinical observation, now enjoys a level of understanding and objective assessment that was never before possible. As the philosophical and practice principles and methodologies have improved, so has the educational system. Intra-institution faculty and curriculum development, Collaborative educational programs with conventional medical schools and modern textbooks have dramatically improved education. I often hear from early students their bittersweet wishes that they could go to school now. A trend that I think is of great significance is the establishment of residencies. Although residencies are available to only approximately 10% of graduates, and only one state requires a residency before eligibility for licensure. This is an important trend. Special commendations to Cancer Treatment Centers of America, which has established several accredited residencies for naturopathic graduates at all its hospitals. Finally, we now see development of specialty departments, not of diseases, but rather methodologies foundational to naturopathic practice. A good example is the new department in detoxification and environmental medicine at Southwest College of Naturopathic Medicine. Enrollments have increased to approximately 1,600 students in 4 accredited schools. In summary, the decade of alternative therapies in health and medicine's existence has seen dramatic advancement of the naturopathic profession in all areas: research, quality of practice, quality of education, licensure, inclusion in the political process, and public acceptance. Naturopathic doctors are now valued in the marketplace and in policy as a legitimate part of an overall system of healthcare. Momentum, infrastructure, acceptance, and conceptualization are all foundational to the future. Alternative Therapies in Health and Medicine was one of the first journals to invite naturopathic doctors onto its editorial board, Pizzorno and Standish. Our profession thanks and applauds you for inviting us.